Welcome to BizBody, where we talk about the art and science of exercise to help you solve movement and pain problems.
So hopefully, over the course of the next few weeks as we're going through these different things, we can get through this stuff so that you guys can start to understand like where we're coming from as two practitioners who probably overanalyze everything. But
because we got put in our place.
Yeah, with that being said, it's because we've been humbled over and over again by people that are way smarter than us that, we're trying to take, we want to take things that are that can be very, very complex and start to make them easier to digest.
Right. We'll try to minimize all the choices to be made rather than the over-expansive choice continuum that you have, because there's so many different choices to make on how to intervene with a human, or even to not intervene at all, or maybe even take away a stimulus to feel different. A majority of people, when they first come in here, they want to feel better because they lost some sort of ability. I don't even know if they had that ability to start. Right? That's true. I have no background data on them. I just have this person came in. I get to take this kind of data down, so I have an understanding of a baseline that we've formulated. I have an idea of norms for humans, of stuff that's normative, but a majority of stuff that comes in here, it's non-normative. Like, there's so much non-normative stuff going on, so much non-diagnosed or undiagnosed disease, right? And it's like, if we can stumble upon some of these things quicker rather than later, then maybe we can refer to the right people at the right times and dose out the exercise more accurately from the objective and subjective reportings. And so that's where all this ties together, is being more accurate to save time, save money, save frustration, because we want quicker outcomes based upon exercise-based principles. And if it's not exercise, we can refer to the right medical people as soon as possible to have more people with accurate methods of intervention giving people results.
Right. And I think like when we start to talk about the whole idea of like exercise being medicine, like you hear that term getting thrown around all the time. It's like, well, what medical professional have you ever gone into that hasn't taken like a medical history and had you fill out like, or at least got your medical records and looked at all the things to be able to have a discussion with you versus like I don't remember the last time going to a new doctor and filling out a waiver and then that doctor not talking to me but giving me 4 or 5 prescription medications for the things that I was complaining about, right? Like,
except those online docs.
Yeah, but it's like, we talk about that stuff, but it's like, okay, if that's the case, like, as a practitioner, as somebody who's looking to start an exercise program, like, if you walk into a gym and they give you a waiver to fill out and that's all you have to do, that's the barrier, to entry. It's like, man, like there's a lot of choices you can make. And you know what? Like, if that doctor doesn't know much about me or has chosen not to gather information about me and puts me on a medication, that medication is, I don't know, way higher than it should be. Like, what are the chances that I'm going to have complications with that? Right. Or maybe the dose that they give me doesn't touch my problem at all because it wasn't a high enough dose to begin with. That's what we're really talking about here is like, how do you dose these things? Like, you have this ankle problem. How would you even begin to start to address that, like from an exercise perspective? Right. And do we address it, head on, or do we do it indirectly initially, right?
Well, like locally, systemically. I mean, these ideas are, again, if someone believes that something that was injured, right? If someone had an injury, like injury being an instance of being injured being harm or damaged or impaired, injure mean to do physical harm or damage to. If these stages of injury, which get defined in a couple different ways too, like, which is interesting in the literature. Like, you get defined as orthopedically, which is acute, subacute, and post-acute. Acute being 0 to 4 days, subacute being 5 to 14 days, post-acute being after 14 days, and PubMed on orthopedic labeling for trauma, and then the chronic injury lasting over 3 months, 4 stages of wound healing. I mean, there's so many different definitions of these things. Way back in the day, there were different studies of the nervous system where they're like, if I stimulate one part of the nervous system, the whole thing lit up, right? And there was another study that talked about like one little cell being stimulated, and then the whole nervous system lit up. So if there was a problem with one type of tissue and now the trauma made all these other tissues that are grown out of this stuff, that are wired for movement and perception, like, does that ever change? And now you're injured on your shoulder, and then you had an injury on the foot. It's like, would a foot injury ever change how you walk and utilize the shoulder? And would a hand injury ever change how you use the shoulder or the opposite shoulder? So I'm not like, this hand hurts, I'm going to use this shoulder more. Or you can start to see that these things may interact differently. When people talk about nature and nurture, that there's genetic components, but there's a whole bunch of nurture. It's like, how did I use this stuff? What happened to it? And a lot of people are very familiar with post-traumatic stress disorder of the whole system. But like, what about of local tissues? And then how that forms circuits for protection. So it's almost like if you kept on spraining and hurting an ankle, why would the system let you load it over and over and over again? Like, if it's going to risk more trauma,
Right.
it's going to try to protect you.
Right. Whether you like it or not.
Yeah.
And I think that's the big point is, there's solutions the body comes up with that we may not like, but they're the solution that the brain came up with for whatever reason, right? Like, the brain doesn't exactly tell us why it's doing what it's doing. It's just doing it in protection of itself, right? It's trying to guard against us as humans that have free will and the capacity to make decisions to try to override what it feels is the best for us, right? And it's phenomenal that it has the ability to do that, but it just may not be convenient, at the time, right?
And what makes exercise so unique as a way to help solve movement and pain problems is that not only can it be used to see like how you're interacting with your environment, you can also use it subjectively to say like, was it okay that I moved this way? Not just a whole set, meaning I'm going to raise my arm up and down for as many as I can. What if I just moved it up? Was it okay? What if I controlled it down? Is it okay? What if I did the same thing on my back? What if I did the same thing on my side? You can use it as a review process, a way of like, oh, well, here's all the places that I can move that are okay. Here are all the places that I'm having trouble right now. And now I can start to at least have these baselines of movement and sensation. When we get into peripheral nerve trauma, central nerve trauma, and PTSD of the tissues, then we can start to talk about feel and real too, which is perception accurate with fatigue, with where you think you are in space. This can be a really fun rabbit hole to go down, and that's why when we start talking about all these other pieces, you can start to see, okay, if I leveraged a position isometrically or controlled what people would call the eccentric, right, or the concentric. We use different terminology because we're looking at angles, not muscular contractions. This angle's getting longer. This angle's getting shorter, and can I voluntarily control it, or
not controlling it?
Or not controlling it, right? In what direction is the force going, right? So they're really interesting to play with, and that's why organizing these tools just becomes such a benefit.
This is just so that we can get through the weeds and we can actually start talking about like the fun stuff,
Yeah.
and make it a little simpler. But
Yeah.
understanding the these principles from our perspective will give you a better insight on like why we're giving certain advice at certain things versus, again, it all comes down to context. And if you know the context, then it makes a little more sense down the road.
Because the body is, I wouldn't even call it the body. The human system is far from simple. Nothing's 100%. And it's like it's the only thing that's a constant. Is it's like, okay, there are all these opportunities for things to change based upon context. So how can we make things more reliable, right? So how do things correlate over time, and can they become reliable so that the signals that you think are really happening, the things that you're testing for, or that you're trying to pick a signal up on, you're really seeing. And that's what we're going to be talking about.
Yeah, so for all you people that thought like exercise is simple and that it's not rocket science, I've heard that so many times, but exercise is very close to rocket science, like in the sense of just how intricate it actually is when you're talking about forces and torques and joints and muscles and lines of pull and all this other stuff that goes into when you choose a challenge for the body, all the things that have to happen for that challenge to be met. Mm-hmm. It's very much rocket science, like when you really understand what you're truly dealing with. And the human body is one of the most crazy, complicated things on earth that we still don't really know a ton about.
Yeah.
Right? So the idea that exercise is just, it's easy. It's, it's like,
right.
Well, yeah, it can be if you don't want to think about the consequences of it.
Right.
Like
it's like saying nutrition's easy. Being able to put a clinical control trial together for exercise, think about all the variables that have to be considered, and then is it even really that reliable? Because it's like, to really have a true representation to compare apples to apples, you almost have to have like the same clone person in the same time period with the exact same foods or the exact same exercise with the set done the exact same way. But even Bernstein himself in the late 1930s said that there's no repetition that can ever be repeated, ever. Yeah. No part of any rep can ever be repeated.
It wouldn't even work with 50 Michael Keatons.
Nobody knows that joke. Nobody has seen Multiplicity.
Yeah.
Okay.
If you want to know the joke, just go back and watch the movie.
Go back. That definitely dates us. Here's some things that came up with the idea of, okay, what things are we looking at when it comes to that are affected with injury? So how would certain diseases affect muscular function and recovery? Like, what kind of diseases are we talking about? And what is a disease anyway?
Man.
So like Webster was like, a disease is a disorder of structure or function in human, animal, or plant, especially one that has a known cause. So you have to have a known cause and a distinctive group of symptoms, signs, or anatomical changes. So I would also just add that like a disease would be, is the system not behaving in normative fashion, right? So it's a non-normative, right?
Right.
So
whatever that means.
Dysfunction being an abnormality or impairment in the function of a specified body organ or system, right? So when we're talking about diseases that affect muscular function and recovery, I mean, you're talking like, what if somebody has like rheumatoid arthritis? What if somebody has gout? What if somebody has
muscular dystrophy
or DISH,
yeah.
or
anything. Like, I mean, disease could be high cholesterol, it could be high blood pressure, like cardiovascular disease, like peripheral artery disease. Like, there's so many things that, if they have a diagnostic code, which is, I mean, like pages and pages of things, like that means that there's just something outside the norm, right, happening. That with a lot of those things require certain medications if you were to go to a doctor to treat, right? Like diabetes, that's a disease,
Yeah.
So whether it's metabolic, whether it's catabolic, whether it doesn't matter, right? Like cancer, disease, like all these things, how they affect the system in general and what's going on that started that disease state or that state of being non-normal. Sometimes you can control it and sometimes you can't.
Right.
Like, and then how does that affect decision making?
Or even exercising, period.
Right.
Because like some disease states, exercise can make it worse, can make it way worse. Like, would you call degenerative joint disease a disease? Or is it just an orthopedic condition? Right. But overall, it's like how the arthritic changes or the changes over time to those joints are occurring, it will definitely affect how it's being loaded or if it should be loaded at all short term. What I would highly recommend is that when somebody is already at least knowledgeable of the disease state that they're in, we have so many, so much at our disposal, so many references at our disposal to look up and see, number one, like, is exercise even an option for this? Right? Because like it may actually hurt you.
Right.
So,
and that's where you just refer to that individual's physician to get guidance on, the things that you should and shouldn't do with this individual. Because again, when you're working with an individual or you're the one that's looking to get into an exercise program, like you want to know whether or not potentially you're putting yourself at risk. Nobody, that I've ever met in this field or, any other field in the medical field in general has ever gotten to the field with the anticipation of hurting people, right? Like the whole point is like you want to help. Sometimes you just don't have the expertise to help, right? In some scenarios, exercise doesn't play a role in that individual getting better, right? And from a training perspective, where we're at in the grand scheme of things, we don't have the license to make that decision.
Not at
right? All. So, I think, from a individual's perspective, if you're an individual looking to get into exercise because you've heard of all the benefits and the great things that it can bring, and you have some disease or diseases, like it's probably a good idea to consult your physician before you jump right in with 2 feet and don't understand how deep or shallow the pool is.
And if you're starting an exercise process with somebody who thinks that they're above the medical system, that's a huge red flag, because overall, no one in the exercise space, unless they're an MD, right? Unless your trainer is also a doctor, I'd be very, very cautious, because there is a hierarchical system for trying to detect problems of higher importance. And if you need specific care, time is of the essence to make sure that you're with the right people, you have a good team giving you the right representation of things to do. That's why this is a part of the steps of this injury process that we're talking about, injury and disease, and how it can affect the system.
Yes, and ultimately, we're in the business of helping people. In that process of helping people, we also want to be able to make good informed decisions, right? And there's certain times where, if somebody comes in with a certain issue and, like if you don't feel comfortable working with that person, it's okay to say no. And just like if you're the individual walking through the door looking for somebody to help you, and you have some of these things, like if they blow it off as like, oh, that's no big deal, like we'll totally get that better, or we'll totally fix that. I would also like question that as well, right? So, at the end of the day, like we've put together systems for us to help protect us as individuals and as practitioners, because there are going to be people that will walk through your door that have no idea that they have X, Y, or Z because it hasn't been diagnosed yet, right? But as long as you as the practitioner have a system in place to start to weed some of these things out, like you can also protect yourself, right? And if you're an individual that's coming into an exercise process and you want to be more secure in your ability to do it, then, taking a quick trip to the doctor has never hurt anybody. It's like, it never hurts to have the information one way or another.
I mean, what does it hurt to have a simple blood test done to see like where your triglycerides, your HbA1c, all these different chemical sides of recovery? Because remember, exercise is the stimulus. Your body has to be able to recover. So if you're already at behind the eight ball when it comes to chemically where your whole system's at, your exercise definitely needs to be adjusted based upon these chemical components. So if someone's not like, well, where's your blood work at? Like, and they're not even putting that into consideration too. It's just like, oh, okay, like your blood sugar's high. You have all these different markers of inflammation, fatty liver disease, type 2 diabetic. It's like hypocholesterolemia, like all these. How do you think people like that are going to recover if you're just blasting them with exercise and they have all these particles that are already like maybe a decade or two into some problem areas of cholesterol? What do you think is happening to their arteries? Like, I mean, like the data is pretty clear on the potential threats of cardiovascular incident or maybe even stroke. So it's like, okay, these things like blood pressure, very basic, blood pressure measured, what's the heart rate at? Someone like asking like, well, what is your current blood panel like? If you mind sharing, so that I have an understanding of where your glucose is at, so you can see whether they have toxic loads of energy. Because it's like if people are just consuming a lot of food and they're not doing anything, their system is at almost like a toxic load of energy. So that becomes very problematic for a person.
Yeah, and we're not talking about like diagnosing people through this stuff. We're just like
risk.
Understanding basic risk, like understanding, if you look at a blood panel, and I'm in a profession like I want to have a basic knowledge. Like I don't need to have a knowledge of blood like a doctor, but I need to have some semblance of an idea of what normative values of things are that when somebody walks through my door may be a red flag, right? And, like, obviously, this could be controversial, like, saying this, but, like, I've always gone by the whole premise, like, people lie, right? Like, inadvertently, intentionally, unintentionally, right? Like, people lie, and that's okay. Like, a lot of times it's done to protect themselves, right? And if you walk through the door and this is the first time we're meeting, like, what are the chances that you're going to tell me everything that I ask? Like, you're probably going to hold some stuff back, right?
But you're going to unintentionally forget too.
Yeah.
So that's going to happen. So, okay, if someone's starting an exercise process, knowing with your basic physiology, especially if you haven't trained in a while, where those numbers are at compared to norm, so at least you have some information. You know how you feel while you're going through certain things. Those are some very simple things you can do right now before you're even doing this exercise process, to take it one step at a time, because the exercise process in itself, it's so that you can function long term, not like it's done tomorrow because I did my 2 reps and it's over. It's how your system will evolve over time.
I mean, it's not a 6-week challenge.
It is a 6-week challenge.
In 6 weeks, we can have you in the best shape of your life, and you'll never have to work out again.
Right. Oh man, that's rough.
Yeah, unfortunately, it's one of those when we have conversations with
How long
clients,
is this
it's
gonna
like,
take?
how long is it going to, the rest of your life?
Like how long is what going to take?
Yeah. I mean, again, it's, unfortunately, the biggest negative to exercise is when you stop, it starts to regress.
Yeah, the
right?
benefits aren't there anymore. It's almost like, what was really cool is that Dr. Tommy Wood had he had a couple people on this paper, if not maybe just one other author, I can't remember. But he was talking about this idea of stimulus coupling or demand coupling. And it's a simple idea of the quality of stimulus into your body and into your mind helps your brain long term. Exercise is a tremendous stimulus. It's not the only stimulus. It's a tremendous novelty that you can do when you're not used to it and something is brand new. But then also, if you're paying attention, attention is the currency of change. What happened when I did this stuff? That now you're starting to figure a whole new skill out, which then becomes so helpful for your whole system. Brain, tissues, like muscle tissue, bone tissue, whatnot. The earlier you start, the better the bone quality, it seems. The later you start, you can always gain muscle, and that bone, that's the fickle part. It's like trying to hold on to as much bone as possible, especially if you're a female. And that's why when we're talking about some of these diseases like osteoporosis, osteopenia, maybe some degenerative joint disease, there's different buckets for this stuff. However, simplistic things to do. Paying attention, parts of reps, like your blood work. I mean, really, really simple things to do. And the blood work stuff is usually covered by insurance. And if it's not, you can get it done fairly cheap these days.
Yeah, especially if you don't go to your doctor to do
it. Or a different doctor.
Yeah.
Okay. So when we come back, we're going to look at defining recovery. We're going to talk about what happens to different materials like bone mineral density, joints, what happens to the system as a whole when it comes to energy. We're going to look at types of normal disruptions to the system of how you move and how it equates to how you feel. And then lastly, different types of diagnostics that we think have really helped us over our careers, and things that just aren't as important as we once thought that they were. And that's all coming up in part 2.
It's all a learning process.
Or part 5.
Yeah.
I don't know how long that lasted, so.
Way longer than
So thank you guys all for listening today and for watching. I'll see you next episode.
Thank you for listening to the BizBody Podcast. If you want to support the show, go ahead and click subscribe and leave us a review. Share this with anyone that you know it would help. Also, if you want to visit our brick and mortar, go to body-activation.com and you can work with us in person, one-on-one. If you're an exercise professional that wants to put all of these ideas into your very own system, check out exerciseproed.com for the Muscle System Specialist course and the Exercise Explorers Club. Exerciseproed.com. Rethink exercise.